All right, we're back with Brandy Kinnear talking about how to add an additional revenue stream to your health and wellness practice. Welcome back, Brandy.
Thank you.
So, quick recap from our first interview. Brandy helped a successful practice get even more successful by taking over their sales and marketing. Now she's helped by now hundreds of practitioners grow their business through different changes in technology, through the pandemic, and now a very effective strategy she's working with on adding a revenue stream. Can you tell us what is that revenue stream and why is it so effective?
I'll tell you first what the deficiency that a lot of us have when we're growing a business is that we're constantly looking for new clients. So
Mm.
there's four ways to grow a business. One of them is to get new clients. That's where most people spend their time. The next one is to increase purchase frequency, so the amount of time people buy from you. The third one is to increase the length of time people buy from you, so the lifetime of the patient, of the client. And the fourth one is to increase average purchases. And that's really where I like to jam is like, how can we go back to the same people that we already serve and offer them a solution to help them at a deeper level that doesn't involve time, energy, an entire team to do that. We've gone knee deep in e-commerce and in private label of professional supplements for licensed practitioners, health entrepreneurs, and national brands. And it's really becoming familiar with e-commerce as a product line and a revenue stream, which can be extremely profitable in practice or in, it doesn't necessarily have to be in a clinic. It could be all online, depending on what kind of audience that you have. So that's where we've been spending a lot of time. We've been playing in that sandbox for quite a while. I would call us specialists in sales conversion and e-commerce at this point, because that's where we nerd out and spend a lot of our time as a team. But it's really helping people take on supplements as an actual recurring monthly revenue stream. And I think where we've lost a lot of that opportunity is looking at supplements as only something to treat an acute problem or a critical condition, as opposed to something that's foundational for everyone's health. We saw the stats in 2021, which I will say was kind of post-pandemic, unless you lived in Canada. And the stats were just that everybody is continuing to take supplements. COVID happened, prevention kickstarted itself. We would have had to jump on the top of buildings and scream as a collective group of, health focused people for 20 more years to try and get anywhere near the understanding of prevention that we have now. And so people have self-indoctrinated themselves into the concept of preventative health. Thank you, COVID. And have started taking supplements or continuing to take them. The growth of the industry is massive. So we're constantly looking at what are the greatest opportunities to generate more profit, revenue, and impact for the people that we work with. And this is kind of where we've been hanging out, is in the e-commerce space.
Very cool. E-commerce, supplements, private label. So I imagine that some practitioners, they don't carry any inventory and they write a prescription and they say, go find it somewhere. And it's out of their hands. Some others, I suppose, would have off the shelf, but hold some inventory, which probably has some challenges. And then you're offering private label and it's e-commerce. So I assume that means it's like warehoused somewhere else and drop shipped and they set up an account. So sort of tell me the difference between each of those solutions as it comes to supplements.
Yeah, so we have a lot of practitioners that come to us that don't actually sell supplements, that have a high volume based business and have been recommending things to their patients or their clients, and they're going and getting them from big box retailers where there isn't quality control and there's really no ongoing relationship with the patient communicating about the supplement, and it's just sort of, hey, go and get it, and Susie's off to Costco to get the cheapest one off the shelf and the biggest bottle possible. And then it sits in her cupboard because Susie has not really fully bought into why she should take it every day. And it's expiring and she's got lots of those in her cupboard, and then it just kind of dies off. And there's really no therapeutic benefit because the storytelling aspect of that is missing. We have practitioners that are currently selling products in clinic and online. You can use something like a dispensary to recommend products to your patients, but you lose a lot of control over the level of profit that you can make off of each bottle, as well as the ability to private label anything. So if somebody didn't want to do private labeling and they just wanted to get better at selling more supplements to their patients, there are dispensary opportunities. The typical traditional is buying it wholesale, keeping it in clinic, and retail pricing it out and having people leave with it in their hand. The new model is sort of the private label, have some in your clinic if you have one, and also having it on a shopping site that is connected to a fulfillment company, and people are getting sent over to your store to purchase, and it's getting fulfilled by your fulfillment partner. And the goal is really helping people understand what products they should be taking monthly, ongoing, to better their health. And we know that they're already doing it because we have the data. We just know that they're typically not buying it from their trusted practitioners. They're going and buying it elsewhere. And it's because we haven't done a good job of owning that story, but it's also because the story's fairly new as far as people's understanding of supplements as part of their life, as opposed to just, something they should take when they're feeling sick or something they should take when they have pain, et cetera, et cetera. So it's an interesting time. There's a ton of opportunity for practitioners right now, and anybody in the health space that are interested in bringing something more to the existing people that they serve that's going to help them out, which is really just transferring the ownership of that storytelling and that, indoctrinating into why they should be taking these products, taking that business away from some of the big box retailers, because they're making all the money and, probably doing all of the work to help them in other aspects of their life. So it's kind of a reorganization of who should be in charge of this line of communication and how valuable it can be for your practice from a profit perspective.
So it's a relatively new trend then that supplements are more on the minds of consumers and patients, thanks in part to everyone thinking about their health over the last few years and realizing that there are things we can do to get ourselves in the best health we can. And my question is, how does a practitioner know this would be a good fit for them? And in what cases would you say for a practitioner, maybe this isn't something that you need right now?
Good fit for anybody who's serving a fair amount of clients a month. So if you're seeing 20 people a month, it would still be an opportunity that you could take advantage of, but you would see the ROI take a little bit longer. If you are running a practice with any kind of volume, you have associates, you've got lots of people coming through your door, there's massive opportunity. Maybe you're a medical doctor and you work in a sleep clinic and you have never thought about adding supplements, but have 1,000+ people walking through your doors every month. There's $60,000 a month in profit sitting waiting, and these people are going to Costco and buying it anyway. So it's just changing the story around, as I mentioned. But I think it's great for anybody that's interested in providing their audience with a new opportunity. Who it's not great for is somebody that's just starting out in business that doesn't have an audience. This is not about, we don't work with, you have to actually apply to work with us, but we work with people that have an existing audience. This isn't about trying to compete online with Google shopping and getting in Amazon and trying to beat out the big brands. Unless you have a massive budget, you're going to have a hard climb to the top there. So it's really about one of those 4 categories I talked about how to grow a business, is increasing average purchase value within your existing business. Also, you have to have some ability to communicate about the products. So you don't have to have biochemistry level reached, but you do need to be in tune in the health space. So if somebody came to me and they have no experience at all in the health space, they wouldn't be a good fit for us. But they could still be successful with it, just wouldn't be a good fit for us.
Yeah. So they got to speak intelligently about the product, and you and I were marketers. And so it's more than just knowing the ingredients. It would probably really help them to have some stories or some ways of explaining what the product does in a really emotional or effective way.
Well, we actually have a program where we hold our clients' hands and we do all the work for them. So we concierge the whole process, and then we do sales training with storytelling and provide them with all of the assets that they need to launch it. So if somebody's working with us, we're doing basically everything and just looping them in for decision making and then helping them launch their product line.
Cool. You said something really interesting. You gave an example of sort of the old model where Susie goes and buys a bottle off the shelf, maybe a really big bottle, and then doesn't use most of them because she's not bought in on why she needs it. Tell me about some of the ways that practitioners can help their patients be more compliant to the protocols and actually take the supplements that they recommend.
Well, I would say when I look at that situation as a business problem, the biggest thing that comes to mind is, and I've seen this happen over and over again when I'm consulting with practices and trying to find out the gaps and what's wrong and where to plug the leaking buckets. Often they're being told quite a bit of information on that day when they're getting that, set of supplements recommended to them. So there's a level of overwhelm that doesn't often get supported with follow-up continual education. So if you're going to say, look, I need you to take this, this, and this, take this one at bed, take this one with food, and I'll see you in a month and we'll see how you're doing. And then there's absolutely no communication post-delivery of that treatment plan. You are relying on somebody who's likely already overwhelmed, probably, underwhelmed in life because they're exhausted and they finally sought out professional care and they've got something wrong with their health. You're relying on them to retain that information and indoctrinate themselves into the, high need to take that product every day and remember what it's for. And often the names of the products with some of these professional supplement companies are obtruse. They don't understand what it means. So they really don't remember why, and it's hard for them to explain it to someone else. So if you wanted to flip that on its head, what's supporting email, text message, phone calls, app, if you're working with any of the apps in our industry, what communication can you provide to remind people why they're taking it, how important it is, and keep them compliant because they understand that it's going to work for them in your overall, broad scope of care for them, your plan, your master plan for them. And it's everything we do in practice. Typically, if I looked at where success points were lacking, it's in the communication strategy, the ongoing communication strategy. I'll tell you a story. I went and met with a practitioner and she was well known, but I met with her director of operations and she's like, Brandy, you have to come in and help us. This is a few years ago. And I went in and I did a full analysis. This is when I physically used to go to businesses and I would spend the day there and I would go through and sit down and review their entire process. And she sent a patient home with, had to be about $600 worth of supplements and this package of all of her reports from her lab testing. And she was using a software company that prints you out this 800-page report. And, this lady's leaving and she literally looks like, just a deer in headlights. And I asked them to monitor her and tell me when the return, the call to action for the client was to come back in 4 weeks. And so I asked the director of operations, just based on this one particular client, to give me feedback based on their exact structure. Don't change anything. When does she come back for her appointment? Well, she didn't come back for her appointment. And then I asked her to go back and analyze how many people weren't coming back for their appointments. And then I asked her if these patients could clearly tell their spouse or their best friend or their sister or their brother, whoever in their world, what they learned about their health that day and what they're going to be doing next to the person that they communicate with after the treatment plan. And if they couldn't, the reality is nobody's coming back because they have no idea what happened. Just got hit like a deer in the headlights. And if they can't explain it to someone else, there's a good chance that they don't remember it, they don't understand it, they're super overwhelmed. So how do you break that down, and how do we engage different aspects of communications and, probably bite-sized pieces of a treatment plan instead of $600 worth of supplements in business that you're never going to get back. You might have felt like you've given them the whole world. Here it is, here's the whole world. But they didn't feel like that and they weren't coming back. So everything in business, doesn't matter if it's a marketing business, a plumbing, but it doesn't matter what it is, especially in the health space. We know that people are coming to us because they're really not in a great place typically. So how can we give them more tools to get better without overwhelming them? And it's the same thing with supplements. How can we give them the education that they need without overwhelming them and have them build foundational health at a better level long-term?
So patient overwhelm is something that's really harming the patients and reducing the
return visits, really. I mean,
reducing the return visits. Yeah.
Which is why most businesses are constantly focusing on new patients. When we look to grow a business, we look at, well, who are we leaving out? Who are we losing? Why are they not coming back? What are the leaking parts of the bucket within the business, rather than going out and looking for new ones? Because there's often quite a bit of revenue sitting there waiting to be reactivated and kept, as opposed to, constantly filtering out of the bucket because we're missing systems in place. And it's the same thing with supplements. A lot of people will sell supplements in their business. They might say, oh yeah, I sell all these supplements in my business, but they're not gaining the return sales. So there's no recurring product sales. So they've done the work to indoctrinate the client into the products, and they've told them why they should take it, and they've left with it, but they're not getting the return sales. So there's, again, just, leaving money on the table. So I feel like there's a lot of leaving money on the table in this industry. And my goal is to collect that money back up and put it back in the practitioner's pocket by way of adding on additional revenue streams to capture that back. Because while I am completely heart-centered and passionate about helping people understand and build awareness to natural medicine, I feel like almost everybody I work with is working really, really hard, and they're leaving money on the table. And it's not due to lack of trying, it's just due to lack of know-how. So I feel deeply about people making more profit. I'm okay with talking about money in this space. I feel like Brandy gets on the call and everyone talks about money, and we're okay with it. And they might not want to talk about money with their friends or anyone that they work with, or sometimes even their spouses, their partners. I'm okay about talking about money, because I believe that money doesn't need to go to Costco, Walmart, CVS, and Amazon. It should be going back in the practitioner's pocket.
That's great. Well, you and I have a shared mission to get the word out and help natural practitioners of medicine become more profitable and help more people. So I think this is a great opportunity. And if anybody's listening and wants to book a call with Brandy, talk about making the business more profitable, whether it's through adding this particular revenue stream or something else, she's quite brilliant. And tell us how we can get in touch with you.
Well, if somebody's interested in my fast track program, it's youridealpatients.com/fast track. You can book a call. We can see if you're a good fit. We do launch products within 60 days. So it's go time if you want to do that with us. And if you just want to hang out, we're over at Your Ideal Patients on Instagram, or my website. You can always hang out there, youridealpatients.com.
Thank you very much. Is there anything else you want to leave us with, Brandy?
I just wish everybody an amazing Q3 and Q4, and let's go. Let's
go. Awesome.
Thank you for listening to the Expert Speaker Podcast. Be sure to hit the subscribe button and leave us a rating so that more people can discover the Expert Speaker Podcast, and so more people can be empowered to share their message. Be sure to go to www.expertspeaker.com and take the masterclass to learn how to grow your business and make money speaking. It's totally free and will change your business. If you're ready to work with Expert Speaker, you can apply. Just go to expertspeaker.com/apply, and someone from our team will be in touch with you to help you grow your business with public speaking. That's expertspeaker.com/apply. We'll see you in the next episode.